I was getting ready to go to deploy to Iraq for a 15-month deployment. And one night I was having this, felt like my heart was just racing. So an unusual situation. And I didn't go to the doctor. I said, oh, well, it'll go away in the morning. The next morning it was still there, not that bad. That afternoon it was still there. And then I realized, hey, this is something abnormal. Well, I've not experienced this before. It was not in any pain. It's just a bit of discomfort. Went over to the emergency room, and the next thing I knew, I was being evacuated down here to Brooklyn Medical Center. That's when it was identified that my heart was not pumping. He had lower than the normal.
Time to embrace change and be about that life. This is Dr. Bass with the About That Life podcast, the podcast about life, or living intentionally forever. As you know, February is Heart Health Awareness Month. Coronary artery disease and vascular disease are the #1 killer worldwide of all individuals. Now, we oftentimes think that whether it's money or where you live or where you're from that impact your risk of heart health. But what we know is that across the spectrum, individuals can be negatively impacted by cardiovascular disease, especially executives, individuals that are type A, very busy, right? Myself even included. Sleep is a wish, eating healthy sometimes is a wish. But what we have to understand is that there is a certain level of importance that you have to place on your own health. So today I have one of those super busy individuals, and I'm glad he was able to take some time out to talk with us about strategies for heart health for the executive, but also strategies for heart health over the long term. He's exhibited healthy lifestyles throughout his life, which have propelled him to leaps and bounds. We'll talk about some of the things that he's doing now, but I want to introduce to some and present to others General Andre Pagui. Sir, how are you doing today?
Doing well. Thank you for this opportunity, Dr. Batts. I want to tell you, thank you for your leadership in this area. This heart health, cardiovascular issues are very personal with me. Personally, with my medical condition, as well as cardiac issues have been prevalent throughout my family history. So I'm glad that we're having this discussion today, and thank you for your leadership with this.
Oh, no, thank you. It's more of a joy than an honor. I mean, it's a mix of both, and to have you here knowing how busy your schedule is. So, well, first off, tell me a little about yourself. Now, I know I've been able to read your bio, and I tell people whenever people are Wikipediaable, I don't even know if that's an adjective. That's when you know, but talk about your humble beginnings and how you got to where you are. Then we'll hop into some of those other things regarding family history.
Great. Thank you, Travis. I'm from Arkansas, a small rural area, about 1,200 people. Yes, sir. And my father was a principal there, and I went to University of Arkansas at Pine Bluff. Went there to be a dentist, primarily. And when I enrolled, there was 2 courses that were mandatory courses. One was physical education, and one was ROTC. Physical education was way on the other side of campus. ROTC department was 2 buildings over from my building, and I didn't have to change. It was easy. So I decided ROTC. And I had an academic scholarship, so I kept my grades up. And at the end of the first year, to my surprise, although I had high grades, the institution told me that, hey, my scholarship was going away.
Whoa.
And the ROTC department offered me a full scholarship. Of course, my first answer was no, I'm not interested in joining the military. And a smart advisor there, a professor of military science, called my dad. He said, I just want you to know that your son is turning down a full ride.
Oh.
So my dad called me in, didn't force me to do anything. He said, son, I think this is a great opportunity for you. He had served a World War II veteran and said, if you take that scholarship, I'll buy you a car. And for me,
that was it.
That's the word I
You were son. You're like, where is it?
It's a done deal. Really didn't have a full appreciation of what that meant.
Yes, sir.
Fast forward a few years, came in the military in 1981. I was a logistician by trade.
Explain to the folks what that means.
Absolutely. That's a supply chain manager, a distribution manager, a maintenance manager, maintain operational readiness of the military equipment and people so they could execute their wartime mission.
Okay.
So that was my initial skill set. And after my initial 4 years was up, initially I thought I would get out, but I enjoyed what I was doing.
Mm-hmm.
I was fairly decent. I was good at what I was doing. So I said, let me sign up for another tour or two. Yeah. And next thing I knew, I was at 10 years, which is halfway to 20. I said, well, I think I'll stay in and do 20, and I was still enjoying what I was doing it at a high level. Got to 20, and then the Army has a way of kind of putting incentives out there in front.
Hanging that carrot in front of you.
Exactly. There was a promotion, a job that I liked at a location, and the next thing you know, I was selected for general officer, and that was quite an honor. And ended up being instead of a 4-year mission, it turned out to be 38 years, 6 months, and at 13 days.
My goodness.
But enjoyed every minute of it.
No, and you tell that story like, oh, it just happened like this. But you had to be purposeful about those things. And you said something, even though you minimize it, I was pretty good. You don't get to make general officer being pretty good, right?
That's true.
That's true. You had to really look at the job and reframe. There's a book that General Honore wrote called Leadership in the New Normal. And I talk to people about that in healthcare to say, hey, look, sometimes you have to act in the face of adversity. You have to go against that grain. And when criticism says, hey, we've been doing it this way for so long, and I know that part of your career is change, is understanding that change is inevitable. Can you talk about that piece? I mean, 38 years in the military, and I know you've seen a lot of ups, downs, comes, goes, lefts, right. Talk about that a little bit.
Yeah, well, I was taught early on that in the military, it's unknown from one day to the next, and you have to get comfortable being uncomfortable. Easier said than done. But when you can kind of understand that, what that means is you got to be professional in what you're doing. My father taught me when I was at a young age, there was 3 things you could do to be successful. Number 1, do the right thing. Know if you're doing the right thing, you're going to be all right. If it's worth doing, do 100%. Give it 100% effort. And he taught me that for me to be equal in society's eye, I had to work twice as hard. So put in the work. And then at the end of the day, remember the golden rule. Treat others the way you want to be treated. And I think if you can do those 3 things, you put in the work, do the right thing, and make sure that you're doing the right thing to protect your character, you can be successful. With that foundation, I put those principles into work at every level throughout my military career. You got to put in the work, do the right thing, and treat others the way you want to be treated. Sound very simple, but you would be surprised how many people are not abiding by those 3 simple principles. And for me, that's been successful. World's going to change, life's going to change, your requirements going to change, but if you can adapt because of the work that you've put in, and when those opportunities present themselves and you prepare it, you can be successful. And that's what I owe to my success.
No, and I love that. I mean, that's T-shirt fodder right there. You put that on a T-shirt. No, but you have to put the work in. I think people have this thought that it's supposed to be easy. And that's why I wanted to foot stomp the point that, hey, I got the general officer. That is not something. Number 1, it took time.
Right.
Number 2, it took building relationships. And number 3, it took being good at what you do. And when we look at that in a context, we say those same principles can be applied to health, right?
That's right. That's right. Exactly.
Because I know the Army, my dad was 82nd Airborne. I am military as well. But you don't just get to be out of shape. Now, how did you maintain health? Putting in the work, doing those things. How did you do that for 38 years? Because you look fit now. I don't know if I'd want to have fisticuffs.
Well, thank you. I don't think you would have anything to worry about.
Yes, sir.
Well, as you know, the military requires certain physical standards.
Yes, sir.
That you must meet. And those physical standards are tested on an annual basis. Some minimum requirements that you have to achieve, but it's really just motivation and the self-discipline that you have to sustain yourself. And basically to sustain yourself in a combat environment. All of the tasks that the military requires, at the end of the day, is about combat operation. Our hope is that we never have to execute those tasks, but given that we have to be prepared to do that, we need to be physically fit to be able to do that in the military. So that's why physical fitness and standards is important in the Army. And for me, it requires at a minimum of 3 days a week of putting in those calisthenics, cardio exercises, running.
Yes, sir.
For me. 2 miles is a minimum standard at a certain time frame at every grade. When you're young, that's easy. As you grow older, it's a little bit more difficult, but it becomes more important the older that you get. So just finding a regimen or a routine, finding a time that's best for you and your family to execute that routine and do it every day. Be consistent with it and try to exceed every year as you get a little bit older. Do a little bit more than you did the previous year, or at least as much, where you can maintain that level of physical fitness. And then I think that's helps you mentally as well.
Yes, sir. Well, you just gave us a master class on how to develop a health strategy for the maturing health exam. I mean, we need to, I'm going to package that up. I'm going to get you to sign in, get your face. No, we having fun because I just love the fact how you simplify something, like you said, that people make complex, right? You do it every day. You know, if you didn't perform the way you wanted to before, you got to do a little more. And that's what the athletes that I work with, they say, oh, I'm not happy with my time. Well, what did you do to change? Well, coach, life isn't about developing excuses, right? Developing those tools that build roads to nowhere, right? It's about working to get to where you want and getting there. Now, we share something in common in full disclosure, right? We are both men of an illustrious organization that prides itself on achievement, and that's been reflected in, of course, what you've been able to do from a career standpoint, from a health standpoint. And again, we are men of Kappa Alpha Psi, and that's one of the tenets is that we work to kind of have that continuous achievement. Now, how do you do that when you're already at the top? How do you, because a lot of people say, well, I'm already there. I'm at, there's no more for me to do. How do you continue to push yourself to want more?
Yeah, well, that's what achievement is all about, trying to improve yourself in whatever endeavor you're trying to accomplish at any given skill. You look at professional athletes. My wife and I are big Steph Curry fans. The greatest shooter that God ever made. Mm-hmm. But I would tell you, when he was young, it became natural for him. As he aged, he had to work harder to maintain that high level of skill. He put in the work in the off season, so it was obvious that he could still sustain that high level of performance when the regular season started. As military and as men, in particular, we have to do that same thing. We have to put in the work, and it's more important the older we get to put in that same level of effort, to increase that level of effort, to be able to sustain that same level of excellence that we'd achieved when we were young. So, again, it goes back to that discipline, those programs that you establish when you're young, finding times in your routine where it becomes normal. It becomes a part of your normal day-to-day operations, and you don't think about it. And you'll be surprised. I've been surprised how well it not only helped me physically and mentally, it rubbed off on my family, my wife and my daughters. Also, tried to stay physically fit. And as I talked about earlier, there's heart issues in my family, and I want to take example of where my father did not participate on these healthy thought challenges when he was younger, I think, and it caused him issues as he aged. So from that personal him, I've learned that if I want to be able to build a healthy, sustainable, active life as I get older, I need to stay active when I was young.
Yes, sir. And two things, you mentioned getting your family involved. And when you were talking about those tenets of how you develop that is what works best with your family. And we were joking before, you say, I got a gym at my house and equipment. And before I knew it, my wife was in there. But it's like you said, when they see those pattern behaviors and that regimen, I look at my children. My oldest daughter is a Division I athlete. I was a Division I athlete. My two younger children, they both play sports. It's part of making that, like you said, part of your daily routine. Getting up and not exercising, not doing mobility should feel odd and feel awkward. Now, you touched on something else that again, is something that impacts all communities, but especially communities of color. The point about family history and what you've seen. And, I always have a saying where patients come in and say, well, it always happens. And I say, well, experience isn't the best teacher. It is a teacher. But you can choose to learn from others' experience so you don't have to experience that. And to experience heart attack, stroke, vascular disease, those are things that you don't want to experience because many of the times those can be irreversible. So talk about that piece as much as you can on how knowing what your family history was important to help guiding you to decrease that risk.
Yeah, absolutely. I watched my father at a relatively young age, and he would think he would have an indigestion. And he really never went for those routine checkups where I think could have identified early on some of the important issues that he was having. Until he had his first heart attack, and then he realized that he had some clogged arteries, and there's some things that at that time, if he had been living his life differently, if he had changed his eating habits, if he had been more disciplined in his exercise routine, could have prevented some of that. Unfortunately, he succumbed to some of those heart issues later in his life and died at what I think a relatively younger age. I have two other brothers. All three of us, just kind of, from a generational perspective, have some of those same heart issues that my father had. There's high blood pressure, if you will. I have cardiomyopathy. That, as you know, my heart doesn't beat as strong as it should. So when I was identified at that, I realized that, hey, this is something that's in my legacy, in my history, that if I don't take action now, then I could have the same outcome as my father. I may not have the longevity that I would like. So I started exercising more. I started watching what I was eating. I cut back on the salt. My wife, in her preparation of the food, changed fresh fruits and vegetables. She's even the plant-based diet now. I haven't quite achieved that level.
We're going to talk about that.
Yeah, but it rubs off in the family. It becomes a family dynamic to be healthy.
Yes, sir.
My wife is a yoga instructor, and she gets me in the gym on occasion, not as much as she would like. And we go through some of those stretching exercises that's good for your muscular skeleton body.
Yes, sir.
That's helpful, as well as those physical training with disciplines that I try to exercise. So it's a holistic approach of trying to stay healthy.
Yes, sir.
Knowing that I have a history of heart disease, what can I do now to prevent some of those challenges that my father had later in life? Changing the diet, exercise, all those things are important now in every step of the way. And then monitor. Go see professionals. Seek that help. Get those tests right. The military has allowed me to have that ability to do that fairly routine. In fact, it forced me to do some of these annual physicals. I don't take that for granted, and I really appreciate that. And I think that I'm in a better health position today than I would have been if I hadn't had that force from the military. But I learned early on that, seeing the example that my father said, where he should have been different, been better, I think, in choosing some of his medical routine exams that he did not take. I learned from those, and hopefully it will prevent me from having those early challenges with my cardiovascular system, and then extend my longevity of life.
Yes, sir. And you said so much there that was important, getting those routine checks. A lot of people want to go, it's almost like our car. We don't want to get the oil change. We want to wait till the engine blows up.
That's right.
So it's those routine checks, those making sure that, okay, something's not right. You highlighted something my dad was having indigestion, but now that I think about it, it probably was some of the early underpinnings of heart disease. And
That's right.
I think we always anticipate heart attack as being this big, grandiose event where an elephant's on my chest and I can't. And for some of my patients, it was just as simple. Like you said, oh man, I'm just still a little different. It's a little tickler. Something's just not right. And for me, many of my patients have a relationship where they'll send me a message and they'll say, and I tell them, my dad used to tell me, when you meet a man with a hammer, everything looks like a nail. So if you tell me you got a tickle in your chest, that could be your heart. Dr. Baxter, I have no idea. That's why you need to get checked out.
That's right. And we as African-American men
Thank you.
are the one demographic, I think, that fails to take advantage of the medical capability that's out there just by going and get it checked out.
Yes, sir.
Checked out. Very important. If I could stress one thing, make those routine checks to the doctor, just to have those routine evaluations, that if there is an issue, we can identify those early on where you have a better opportunity to treat those before they become more catastrophic.
Yes, sir. Now, and you highlighted something else that I didn't know. We can, cardiomyopathy. And so from a science standpoint, so cardio is heart, myo muscle, opathy is disease. So disease of the heart muscle has a ton of different causes. And sometimes, in many cases, it is idiopathic. We don't know why it happens to some folks. We don't have to get into the specifics per se, but after getting that diagnosis, did you say, well, darn it, all those healthy things that I did before must have been for naught? Or if anything, I ramped up those healthy, because I do have some patients that have done everything right and getting ready for retirement out of the military, or retirement from a job, They come to see me due to an abnormal EKG or something, and I give them a diagnosis. And they say, well, what's this? What happened there?
Yeah, I'm glad you asked that question. I was getting ready to go to deploy to Iraq for a 15-month deployment. And one night I was having this, felt like my heart was just racing. So, an unusual situation. And I didn't go to the doctor. I said, oh, well, it'll go away in the morning. The next morning it was still there, not that bad. That afternoon it was still there. And then I realized, hey, this is something abnormal. Well, I've not experienced this before. I was not in any pain, but just a bit of discomfort. And we had a physician at the division headquarters that was a friend. I said, well, let me go talk to him and just tell him, say, hey, see what's going on. And I went in, he took my blood pressure, listened a bit. He said, hey, there's something going on. I don't know what it is, but we need to get some professional help. Went over to the emergency room, and the next thing I knew, I was being evacuated down here to Brooklyn Medical Center for the evaluation. During that evaluation, took a series of tests. That's when it was identified that my heart was not pumping. He had lower than the normal level. All the other tests checked out fine, but there was something going on, and the cardiologist wanted to make sure if I had to deploy, that I would be safe and healthy to go. So it ran a series of evaluations, and he determined that if I took some minimal prophylactic medications, it could help prevent this from getting worse, and really just described that, hey, do the things that I'm doing, but increase it a bit, and then manage my diet, and continue to exercise, and we could manage that and just watch every year. And that's kind of what I've done. I've not had a reoccurrence, but again, I'm evaluated every year. Have a series of tests periodically to make sure that there's no damage and it's not getting worse. In fact, it has gotten a little bit better over the course of time by eating properly, continue to exercise, watching my weight, and those things are all important, as you would know, and you can say better than me. That has put me in a position where I think I'm still relatively healthy, and I can still do all the things that I could do 20 years ago. But just because I think that I was involved with my healthcare professionals, and not afraid to go in for those routine checkups, took the advice and put it to heart, took it to heart, and executed the things that they directed that I should do. And again, as I said earlier, there's some things that we as African American men hesitate to do. Men in general, I think.
Right.
And we tend to be at a higher risk than others.
Yes, sir. No, and I always tell my patients, first, thank you for sharing, but I always talk to my patients that your heart diagnosis, so your cardiac diagnosis doesn't have to be a death sentence, right? I want it to be a life sentence, right? I want you to live intentionally forever. And that's what you added intention. You were already doing things, but you say, you know what? Let me double down on these lifestyle strategies. And when the other thing that I tell my patients is there's an acronym that I use for what we call the 6 pillars of lifestyle medicine. And it is, did you take your meds? MEDSSS. The first one is mindfulness and being able to refocus and to allow yourself the privilege of relaxing.
Right.
I think that is a skill that health professionals, executives, they don't teach us that. They say go, but they don't teach you that you got to hit the reset button every now and then. So that's M. E is exercise. And it starts just like you said, hey, 3 days a week, 4 days a week. Sometimes I do a little bit more. When I'm traveling, I have to change that. But making sure that exercise is part of it. It's the E. D, diet. Now, I am plant forward. Your wife is. You're going to be there pretty soon. And we talked about it, right? I often say, the enemy, basically that the absence of meat isn't the presence of health.
Right.
So if individuals would just stop eating crap, carbonated beverages, artificial sweeteners, refined sugars, and processed foods, they would be better, right? That's the thing, getting rid of those false foods. And so that's where diet comes in. And then the last SSS, right? So the first S is sleep, making sure you're getting enough sleep so you can reset and recover. The next S is going to be social connectedness, building a community, whether it's with your family, your fraternity, or other individuals to involve in getting rid of risky substances, whether it's an energy drink, tobacco, whatever it is, using those strategies to improve your health. There was an article that came out specifically about cardiomyopathy, because we often say, well, we don't know what causes, so how do we know? And they implemented these strategies, and what they saw was individuals saw a marked improvement in their overall quality of life, as well as, you ready, their quantity of life. Because they made some changes that improved. Now, the numbers made bumps, but because they had so much more vitality, they felt better. Thinking back to that time, moving forward, you mentioned the deployed environment, and I had the pleasure of being in Afghanistan and realizing that I was the only cardiologist for about 3 countries, and I saw a lot of things, and I saw a lot of diseases of excess, mostly in us and the contractors, and the disease of excess, obesity, diabetes, joint pain when you wouldn't expect it due to obesity. How do individuals combat that? Because I could tell you, you look fit, you look, knowing that you're doing yoga, knowing, how did they do that? Understanding that, hey, I'm getting older, man. A lot of my patients say, well, I just can't move them. It's old age. But I see, people doing things at all ages. I'm not going to ask you to say how old you are, but I mean, it doesn't, you look great.
Right. Well, thank you for that. I appreciate that. Don't necessarily feel maybe the way I look, but I appreciate it all the less. So, I believe in this three-legged stool approach to life. And it's about balance.
Yes, sir.
And your professional life, your personal family life, and your physical fitness. We've talked a good bit about physical fitness, but I think if you get any one of those stools out of balance, it affects you in multiple ways. And for me, I've worked hard to try to maintain that balance of my professional career, which is always extremely challenging in the military. And the more senior I got, the more difficult it was. But there are things you could do, things that I did to ensure that I worked hard in my job. I studied. I was a true professional, but I worked just as hard in my private and my personal life with my family. Ensure that my daughter was taken care of. I put in the time with the things that she was doing that was important for her, and my level of physical fitness. I would carve out times in the mornings where I could do physical training, and then sometimes I would miss maybe taking the kids to school or doing some things with my wife in the morning, having breakfast. But what I would do was, and I was taught this early on, that I was always at home for dinner in the evening with my family. I mean, I may have to stay up and work late after they go to bed. I get up early, but that family time was extremely important. I found too many of my peers at the senior level, senior executives, that did not have a relationship with the kids, and their spouse relationship was damaged because they focused more on professional life and didn't keep that stool balanced with family, personal, physical fitness, as well as the professional life. So for me, keeping that balance in life throughout my career, I think, has been important in me being able to have a balanced life, a healthy life that I enjoy now, and able to do pretty much everything that I want to do in life, or even after I've retired from the military and worked 30 years.
Well, sir, like I said, we're going to have to get back together and write this book, this master class that you're putting on longevity, vitality, connectedness, and that key, when I look at what wraps that all up into a bow, it is balance. It is understanding that three-legged stool of physical, professional, and family, and that social piece that you say, that I think a lot of us, especially on the medical side, and I won't say especially, I mean, that's my frame of thought, have challenges with. I mean, we've titled it burnout, but it is, like you said, well, when you start becoming disconnected, it's almost like you got 3 cords that really power us. And when one of those cords gets unplugged, you still can work in those other cords, but you'll start to dwindle, right? In the way that you described it, you were able to thrive because you fed off of each of those, but not one more than the other, and you valued. Again, at the end of the day, there's a saying that says the only person that remembers you worked late 20 years from now is your family.
That's right. That's right. At the end of the day, and I always tell my young soldiers that I was in the Army. The Army would get every ounce of blood out of you. But if you give all that blood to the Army and not putting that same effort in with the family, then at the end of the day, when you retire, you're going to miss your family. You missed all of those pertinent opportunities. Now, there's going to be opportunities that you miss just by the nature of the beast of being in the military and serving. However, I found too many executive and senior officers put their professional career ahead of their families. And at the end of the day, all you have is the family. And after the military, if you don't have any family to go back on and follow on, then shame on us. And I've tried to be an example. Taking time off, for instance, a big example. The Army gives you 30 days a year of paid leave. Listen, and a lot of military members are pride themselves of saving those days and have 60, 90, 100 days. But what are you going to do without it? And that's why the Army changed the rule about 15 years ago that you could only have 60 days. If you didn't take it, you would lose it.
That's the use or lose.
Use or lose. But people still didn't want to take that leave. They didn't want to spend that time with their family. And I would always take my leave, and I would always track my subordinates for, hey, when are you taking off? How much leave do you have? What are you doing with your family? What are your family critical events that you participated in, and what are those that you miss? It's about mentoring so that by example and by getting to know your people that work for you, what's important for them, you can see if that stool is out of balance and then help them get that balance back in their lives. And they really appreciate that and work harder for you and they're dedicated. And the unit is better for it at the end of the day.
Well, like I said, this has been a wonderful discussion. I thought on health, but this was more of a mentorship discussion for me. So I mean, I'm enjoying it. I don't have a pen and pad, but I'm certainly going to watch this back. But what I want you to do now is tell people the why. Why is it important to balance that stool? Why is it important to stay connected in the context of health, in the context of professionalism, but mostly in the context of achieving?
Yeah, life is short. And I live every day to enjoy every minute of every day. And if you're not taking care of yourself, you can't take care of your family. You can't take care of those men and women that look up to you to set the example and to lead. And physical health, mental health, and family is extremely important. And I implore people that I work with, people that I have mentored, that if you don't have that balance in your life, you can't enjoy life to the fullest. Your family is not going to be able to achieve the level that they would like to achieve. And health is so important for longevity, but ability to do the things that you want to do in life. And I have been fortunate, blessed, to be able to have a modicum of relative good health. And I thank the good Lord for that every day. But there's things that I can do better. There's things that I can do differently. And it's a work in progress. Every day, my motto is to make tomorrow better than today. And if I can do just a little bit, improve my exercise, my eating habits, if I can lose a couple ounces here, and if I can help someone else along the way, then I can be successful in life. I can enjoy where I am in life and make an impact and make a day better for somebody else that's in my life.
You said it there, and the one thing that I always tell my patients is the goal is not perfection, but the goal is progress.
Every day, one day at a time.
Thank you again, sir, for joining us. As I said, this is Dr. Batts with the About That Life podcast, the podcast about life. Today, we got a masterclass on how to balance family, work, professionalism, self-preservation through the lens of health, nutrition, as well as staying socially connected. So wherever you are on that journey, whether you're a healthcare executive, a new employee, or someone who just wants to know how to start, you got it today. Understanding that it starts by you making first a choice that living well is a priority. So I encourage you to continue to take that walk with us. Whether you're starting, whether you're continuing, remember to keep going. And thank you. Have a delightful day. We truly hope you enjoyed today's episode. If you did, share it with a friend, leave a comment, and certainly join us for our next episode of the About That Life podcast.